The man who performed more lobotomies than anyone in American history was not a surgeon. He never trained as one, he never held a surgical license, and for 20 years, nobody stopped him. Walter Freeman was a neurologist at George Washington University. In 1936, working with an actual neurosurgeon named James Watts, he performed the first prefrontal lobotomy in the United States, an operation borrowed from a Portuguese doctor named Egas Moniz, who would win a Nobel Prize for inventing it. The problem, as Freeman saw it, was that the operation was slow, it needed an operating theater, it needed a surgeon, and there were hundreds of thousands of people sitting in American asylums. So in 1946, he found a faster way. An Italian psychiatrist had shown you could reach the frontal lobes through the eye socket. Freeman took that idea and practiced it on corpses using a thin spike shaped like an ice pick. A proper instrument came later called an orbitoclast, but the name stuck, the ice pick lobotomy. Here is how it worked. The patient was knocked unconscious with electric shock, not anesthesia, electric shock, because that didn't require an anesthesiologist either. Freeman lifted the eyelid, set the spike against the thin bone at the top of the socket, and drove it in with a mallet. Then he swept it side to side. About 10 minutes, and it could be done almost anywhere. That was the point. Freeman fitted out a vehicle, loaded his instruments, and drove across the country demonstrating the procedure at state hospitals. The press called it the lobotomobile. He called the trips headhunting. He liked an audience. He would sometimes work on 2 patients at once, one in each hand, while photographers took pictures. James Watts, the actual surgeon, walked away. He hadn't been told what Freeman was doing, and he wanted no part of an operation performed with no sterile technique by a man with no surgical training. Freeman kept going. He performed around 3,500 lobotomies, about 2,500 of them through the eye. In 1941, he operated on a 23-year-old woman named Rosemary Kennedy. She could not speak coherently afterward and spent the next 64 years in institutions. In 1960, he lobotomized a 12-year-old boy named Howard Dully, who was not mentally ill. His stepmother found him difficult. By one estimate, around 1 in 7 of Freeman's patients died. What finally stopped him was a woman named Helen Mortensen. In 1967, he operated on her for the 3rd time and she died of a brain hemorrhage. His surgical privileges were revoked. He never operated again. More than 50,000 lobotomies were performed in the United States. This was never a thing done in the dark. It won a Nobel Prize.